when we had our last talk, which was on the 15th on the calendar, I did talk about the deplorable health conditions that we find here in our fair state, and that's the basis for the time I'm spending here at the microphone. We mentioned that the infant mortality rate here in Alabama is one of the worst, if not the worst, in the nation, and right now, last count, we were 49th of babies dying. We also mentioned general premature death in Alabama. There were several other topics. Children's health care is one of the worst. Let's see, that's not bad. We're 38th in that one. That's remarkably good, considering where we are and everything else. And we went on to mention how attempts have been made to improve quality of care and access of care in Alabama. We talked about how certain almost every health profession had been totally stymied in the legislative process, and in particular, I can outline and mention physical therapy has made attempt after attempt to improve access to services. Optometry has been in the same boat. Of course, you all know that's dear to me. That's my profession. I've seen the pharmacist take it on the chin, be squelched in the process, and we've also seen that happen to respiratory therapy has had similar problems. Radiation techs have been squelched and stymied and essentially prevented from being able to show let's get this thing moving. Okay, thank you. Being able to perform and provide for the public those things that they're trained to do. The latest near casualty we've had was a podiatry bill in the House. Let me say this about podiatry attempting to improve care in Alabama. I've been here five sessions, 5 terms, nearly 20 years. I've never seen a podiatry bill come through the legislature. Certainly not one that made it to the governor. They've all been squelched. They've been killed, and allegedly to protect the public from irresponsible folks. Now, let me tell you how this works. The people that compete with podiatry manage to keep them from passing legislation and updating what they can do. Now, you know, in 20 years that many changes have occurred in all of the professions, and when one profession can come in and block another profession from being able to update and upgrade what they do. This is like you've got a car dealer on one side of the street, and he's able to, or she is able to block the competitor across the street. So the competitor comes out, or the original one comes out and says, well, we're going to offer an automatic transmission. You don't have to change gears in your car. But they managed to block the competitor across the street from being able to provide automatic transmissions. Well, that is what's going on in our state. Now let's go on. Today I wanted to focus on the opioid crisis in Alabama. I want you to remember this. A legal drug that ends up on the street always starts with a prescription. If that prescription isn't written, nothing happens. Unfortunately, thousands of prescriptions are written every day in Alabama. And every day in Alabama, more and more families and individuals' lives are destroyed. There are few families left in this state that have not been adversely affected by this devil concoction. This is a pandemic that has been underway in this state for many years, and it is perpetrated by prescriptions written by greedy, insensitive, irresponsible, and evil so-called health care providers. They are reaping millions while raping the population, all in the name of pain management. Let me read to you now an article that was published. Headlines: Alabama is number one and has been number one for 7 years in a row. Despite declines, Alabama still leads the nation in opioid prescriptions. Alabamians receive more prescribed opioids per person than residents of any other state. To give you an idea of how many opioid prescriptions are written, that is, they are legal when they leave the physician's office, about one per every person in Alabama. One for every person. Is that not hard to believe? The national average was about 50 prescriptions per 100. And in the District of Columbia is the lowest rate, about 25 prescriptions per 100 people. In Alabama, it's about 1 to 1. It's actually been coming down, but we continue to lead the nation. Guess what, folks? Yep, we are number one. All of these numbers I've given you came from the Center for Disease Control. The drug is not the problem. The prescribers are the problem. Responsibility for issuing license to these charlatans is a state agency. And I contend while that agency has the job of issuing licenses to qualified providers, it likewise has the responsibility of revoking license to abusers. Rest assured, the prescribers' identities are widely known. Why aren't they doing their job? Why isn't the licensing agency doing their job and collecting these licenses, taking them away from these abusers that are making millions of dollars? The legislature has attempted to intervene in this travesty of mismanagement. Every time the efforts have been thwarted, there's a private dues paying club, and since it's a private club, rather than call them by name, I will refer to them as the Mucho Dinero Club. They are a very exclusive group. They are well heeled, and they have a strong network of lobbyists. Let's review a few of these legislative efforts that have been squashed by the Mucho Dinero Club. Recently, a member of the House of Representatives, who's also, I believe he's an assistant DA, was frustrated that local law enforcement is denied jurisdiction of illegal prescribers. Yep, that's hard to believe, but it's true. I've personally watched and known abusive prescribers continue their murderous ways while local law enforcement was fully aware of their activities, and local law enforcement was handcuffed by Alabama law. This assistant DA, I believe his assistant DA is an attorney. He's involved in law enforcement. He introduced legislation that would remedy the situation and let local law enforcement take action. But folks, the Mucho Dinero Club soundly defeated his effort. The bill got nowhere. Number two, I'll give you another example. We pay for an extensive database that deals with opioids and addictive drugs. That database, we added $1 million to it to make it effective. And here's how it's supposed to work. When a pharmacist, which, by the way, they're doing their job, fills a prescription, they put down the patient's name and the doctor's name. It goes in the database, and the plan was very simple. The prescriber is supposed to look at the database before he prescribes to see if that person claiming need for that opioid had one filled yesterday or the day before by the doctor down the street or in another town, but they refused. The Mucho Dinero Club has refused to make this mandatory, and these prescribers say, as they say every time, we don't have time for that. So they're not using it, and it's not working, and we're wasting our money. I'll give you a third example. Is this license granting organization is a state agency that is under complete and total control of the private dues-paying club that we're referring to as the Mucho Dinero Club. The Mucho Dinero Club names the members of this state agency that turns around and polices the members of the club. The state agency is charged with the oversight, and there are a couple of unique characteristics about this group. Number one, the members of this state agency are exempt from the ethics law. The same ones that all of you senators are subject to, they have gotten exempt from it. Number two, their finances are secret. They do not have to report. Coincidentally, there's a bill in the House today to correct that. It will be interesting to see where it goes. The Mucho Dinero Club defeated a bill that would put them under the ethics law. Who would not want to be there? And also that would make them reveal finances. And the Mucho Dinero Club come out with what is known as the Chicken Little approach to this, that if we pass that law, the sky will fall. So today we've glanced at the opioid crisis. We've looked at legislative efforts to do something about it. We've looked at how those efforts have been thwarted, and it is not going away anytime soon. At the next visit to the mic, we'll be talking about the cost of restraining other health professionals, preventing them from doing what they're trained to do, and we'll also probably take up a deadly combination of lobbyists and bureaucrats that are all rolled into one. Mr. President, thank you very much for the opportunity. Thank you, sir.
Senator McClendon, always a pleasure. Thank you.